with 3 clinicians and a mic, where we're coming to you with 3 degrees of perspective on physical therapy. So today's topic is going to be about what tummy time really is, okay, and why is it so important. It's something that I am personally very passionate about. I really tell my girls all the time that I feel like tummy time could heal the world.
Literally just said that.
I literally said it. And then she's gonna laugh for a second because I think it's just going back to the basics. That's why.
There's as an inside joke here, but I will say this: who are you, Jessie? You never said who you are.
In case you're new here.
Oh yes. Yes, I am Jessie, the doctor of physical therapy, and you have.
I am Chris, a PTA.
And I am Veronica, PTA as well.
All right, so let's.
All right, so tummy time. All right, Doc. So I'm gonna be the one picking on you guys because it's not my forte working with kids. I have kids. I have a grandkid, but I don't want to work with them. But I do understand the super importance of tummy time, which is putting your baby on their stomach, right? Now, the one thing I want to bring, we're going to talk about why it matters and all of that, but I do want to point something out. A lot of people don't do that because they're afraid the baby may have SIDS or they're going to suffocate. So we get that, but she's going to give you a bunch of cool, ideas and strategies that will be safe for the baby, but also very good. So why is it so important?
Okay, so when we are developing inside our mother's womb, we go into something that's called physiological flexion. What that means is it's that fetal position where everyone's all in the flexion, right? So the babies kind of look something like this. And then they come out and they're still like that, and we do swaddling and they're still like that, right? And so through just time, right, and different positions, we eventually get what's called extension, which is like the straight posture, right?
Straight, yeah.
Now, we don't want to promote the non-extension. We actually want to promote the extension because tummy time is going to help with many things. Number one, it's going to stretch out, okay, the hip flexors, right?
Babies. And again, I'll throw in a couple of things here, but babies, you see them like this all the time. It doesn't matter where they're chilling. Even if they're on their back, they're pulling their little feet up right into flexion.
100%.
So
yeah, so
validating your point.
So it's gonna help with these muscles here, your hip flexors, right? And as well as your extensors of your knees, and to bring them into extension. And then your back, right? So your back muscles are gonna go into extension. Your arms should come into alignment, which we'll talk about the actual proper posture for that. It's going to be helping with the cervical spine and the thoracic spine as well. And then your weight bearing on your hands. So that's just a quick little overview of all the good things that come from this position. There's a lot more to it neurologically, like reflex integration and a whole lot of things that we could talk about that eventually will come from here. But this is like starting into what's going to happen later on in life. This is a basics for the next milestones that are to come in a child. Okay.
To add to that, biomechanically, we have these curves in our spine, the way you call lordotic curves, more in the cervical spine and in the lumbar spine. And those are not present when the baby's in utero because they're in that C shape, right? So the only way we can develop those is to start using those extensor muscles and then start kind of building those curves. And those curves actually function to stabilize your whole core, to take the load of everything we do. If we had like a straight spine, it would actually not take load very well and not take stress very well, because again, easily break, no movement. We kind of have to, our body kind of has to adapt to everything that's put on it, and that shape really helps, and that's all developed through tummy time.
No, yeah, I love how you put it, in terms of if you have a straight spine, because even though when you are standing straight, where the natural curves are there, and they're there to disperse gravity, disperse that force, distributed between your legs, and adapt your head in the middle of your body so you're not like a forward head. So all of that, you guys are saying the earlier on we start, the better, right? Now, I do have some strategies that I've used with my kids and my grandkids, but I wanted to hear from you guys the fear of people putting the babies on their stomach, and I get that, right?
So there is a back to sleep campaign, which I'm sure if there's new parents out there or maybe even students in school right now have heard, the back to sleep campaign, right? Which means that there have been some children that have passed away from what's called SID, sudden infant death syndrome, right? And basically, they're not quite certain the cause of it, and so they started the back to sleep campaign because it was happening to kids or babies that were sleeping on their belly. And so this is where a little bit of physical therapy comes in play. So the first thing is there is a research, and I'm not quite sure who exactly, but I know that there's research that this was happening to kids that were not passing their ear tests, interestingly. So before babies leave hospitals here in the US, they have to pass their hearing test. So that's step one, making sure that got cleared. The other thing would be to have a physical therapist assess your baby, right? Because we're supposed to have some head control, again, not the first few weeks of life, typically, right? But if we're leaving our babies in a long time without supervision, and they don't have the head control, then that becomes a problem, right? So that's the key word there, right?
So
I know it's a trigger.
That. No, you're so funny that you said that, because as you were explaining that, I'm thinking to myself, okay, the strategy is don't put them to sleep in that position, right? Spend time with them supervised in that position. But it's like, who comes first, the chicken or the egg? Because we do supervise them in that position, they start to develop that strength to lift the head, which will eventually translate to when they're ready, not the first days and weeks of birth, but as they're getting a little stronger with that extension, that they can actually turn their heads in bed.
Right, absolutely.
Whereas for those babies that tend to be on their back all the time, they don't even develop that strength. Right.
So what I tell new parents, especially, and I think there's some people out there that say don't do tummy time until 2 weeks after they're born, and you're gonna know that on this panel we all disagree with that. I mean, the baby's coming out and we are already trying to strategize that strengthening right from day 1, hour 1, to be honest with you. Okay. So the first thing is when you're awake, right? When the mom's awake and the baby doesn't have to be awake, but just put them in that position, okay? And then here's a misconception. A lot of the times we think it has to be super flat surface, and that doesn't start like that. Even if I were to go to the gym for the first time, I'm not going to start with a 50-pound weight that I've never done before. I'm going to start off with a smaller weight and ease into the exercise, right? Same thing with our babies. If it's hour 1, I'm not going to be super flat where all of gravity is going to be
making it so hard
for them, right? So we start on an incline. Right? We could start on an incline, right on the mom or the dad or whoever is there for the baby, right on top. Because every time they try to like move their little head up, that's an exercise. That's a repetition. That's moving those extensor muscles, right? And yes, they're in flexion because sometimes we wrap them as well into the flexion, but it'll come with time. It's just a start. So I just, it's big on the repetition, making sure that eventually you do get on a flat, surface, and it's arm position as well. Your baby shouldn't be crying and not liking this. It should be actually fun for them and they should enjoy it. How can we do that? Well, making sure the alignment is right? If their arms are out here like this doesn't feel comfortable for anybody. So making sure that you align their little shoulders like 90 degrees of right under their elbows, right under their shoulders, and then 90 degrees there. And then, of course, you could start on an incline. And
that boppy pillow is one way that I did
the
it.
Boppy
The little boppy pillow, and
They're
then just
so
have them sort of
great.
like over it.
And then also a lot of parents think that all these toys are like what the baby wants, and honestly, those are not needed.
The car keys.
It's actually
a spoon, a car key.
I was just gonna say they want to see mommy and daddy's
Yeah,
face
that's
or
true.
siblings or even the dog and the cat, whatever you have at home. Like it really is just giving them that attention. Please don't put screens. That's gonna be a whole other thing
Oh my
later.
gosh, yes, yes.
But you know, just make entertaining them in that way, especially when they're first born. They don't really need a whole lot of stimulus in that way. Just the mom itself. That's why I think like sometimes just laying in the bed and just having.
Which
the
you
baby
have great
on you.
videos from when you
Yes,
have a
I
little
do.
baby. I mean, she's not a little baby anymore.
Yeah, she's
Nah.
4 now.
But there are some good videos that maybe we can link to this. But
Yeah.
I have a question, Vero, being that you guys work so much with pediatrics, when you place the baby in that position and they start crying, is your first reaction to take them away from that position once they cry?
No, taboo.
No, and like Dr. Figueroa was saying, you know, you don't want them to not enjoy it every time, right? But also, we have to understand that, like she's saying, when you go to the gym, you don't start with a 50-pound weight. When you start a new exercise, you don't really like it that much.
Not that much.
You're tired. You're like, why am I doing this? I mean, maybe you feel better after, but during, you're like, this sucks. I'm so tired. I want to vomit, whatever. So initially, they may not like it's something new. They're using muscles that they never used or are figuring out how to work them. So it can get a little uncomfortable. But again, if you're there to supervise, you start with maybe shorter intervals, maybe a few seconds. Like she's saying, if you're doing it with yourself, with them on your body, I mean, that's usually comforting, so that's a very good start. And then if you're, you know, moving on to doing it on the pillow or on a bolster or something, then, you know, just start off short, start off small, like with anything, and work your way to longer periods.
Yeah, and my experience to add to that is, you know, again, probably why I'm not a pediatric therapist, because I would probably let them cry more than they should. But the truth is that I've noticed with my kids, at least, like I give you that much of an experience, is you know, when they first cry, they're learning how to get your response too. So they're gonna like, I don't like this. And then if the first thing you do is pick them up, you're like almost like teaching them, go ahead and cry every time. So the first thing I would do, and again, I wouldn't torture my kids, I try, you know, to like distract them, you know, show this and show that and see if you can. And then once she did stop crying, then I would remove her from the position so that she wouldn't link the crying with, I'm gonna get that back, like exactly what I want, you know. So that's just me as a mom and a grandma.
And that's a little psychology stuff.
And honestly, I want to say I have 4 kids. I 3 of my 4 were preemies. And 3 of them were in the NICU. So I have a lot of experience with that hard beginning. But I want to say that the parents that start right away, okay, at least I could speak from my experience. If we start right away the tummy time, you really do get less resistance from the baby because they only know the tummy time, right? Yeah. The ones that are starting a little bit later are the ones that may not be as comfortable because now there's more body weight and it's just something that they're not familiar with. So I do believe that starting early is important. I believe that we should definitely see a physical therapist if the parent has a doubt. If you feel like your kid's a little on the floppier side, maybe that they're not as sturdy, or you're noticing that some things are not exactly aligned with what maybe you're reading online, then that's when we go to the pediatrician or a physical therapist and see if you could get them evaluated to make sure that they have the strength and that everything is developing on time.
That's so important, honestly, because we are so pushed to go for babies' care checks, like in the beginning, like that first week, and then it's like 2 weeks later, and then a 4 week later. We advocate, and we'll probably start a whole thing advocating for this for PTs, DPTs, particularly now. Most people are DPTs, to actually do those evaluations. Do be part of that check, because physicians are looking for the size of the head, they're looking for the growth in general, you know, maybe some milestones they might be looking for, but not specifically these development things that are going to facilitate their life so much, to a point where we make a joke among ourselves. We call our babies physio babies because they're so far ahead, the milestones don't even hit them, right? Like we're like, we need a next special milestone for the physio babies, the ones that get tummy time all the time. I do want to add, because I like to self-proclaimed anatomy queen.
Yeah.
One of the cool things that I find that it's interesting is your mastoid process on your cranium, that little sticky out where you're starting, like if you touch behind your ear and you feel that little sticking out bone. Often when babies are born, that's not quite formed, but it's the work of that muscle, those muscles that are connected there, pulling their heads up, that will actually create that. Yeah, and it will create that little spot, so that, and then therefore your muscles will be better aligned going forward, and you'll have and support the head and all of that. I mean, I think we have a lot of topics to talk about, head down, looking at the phone. I mean, this could be a whole thing, right? But I do want to say, if you guys can give us some pointers as well as to what are the repercussions of not putting them in that position. And there are so many, but particularly the plagiocephaly and like a few other things, if you guys can share them.
Before we get to that, really quick, just some research that I just pulled today, and there's tons and tons of research from, I mean, years ago that we've been looking to, but I wanted to pull some recent research just to you know, corroborate what we're saying. And again, everything we do is evidence-based.
Right.
And just some, it was international research studies that I found that were recent, but one said that they did a study with the babies, of course, putting them in tummy time, and most of the respondents did have normal gross motor development, but there was a small proportion that had a delay, 3% of that, right? 97 to 3%. And then once they started doing the tummy time interventions, then 100% of them had advanced motor development.
Oh,
Amazing.
cool.
So
See,
there's
that
a lot
stuff
of
like
things,
blows
and
my
that was a
mind.
study
That's
from
awesome.
this year,
That's cool.
2026.
That's
very
fantastic.
recent.
That's perfect. That's actually just telling all of our listeners, viewers, students, moms, put them in tummy
For
time.
sure. And then the other study that I was looking at from also from 2020, no, this one was 2025, is that findings indicated performing tummy time more than 1 to 2 times per week, lasting about 6 to 20 minutes a session, was significantly associated with better developmental outcomes.
Wow.
So a lot of the, I don't think I found the research study that says
the opposite.
the
Don't
opposite.
do it, right. Which
But
is
you
a
can
good point,
definitely
yeah.
ask us for more research, or we can point you to the right direction. And that personal anecdote, like Christiane was saying, I also have 4 children, and especially the last ones, because when I first had my first one, I was just getting into physical therapy.
The knowledge wasn't
The
there.
knowledge wasn't there. But definitely the last 2, I mean, like we're saying, advanced, based on the guidelines that we have now for motor skills.
Just a side note, it's not required for you to have 4 kids to come into
No.
therapy.
Yeah, no,
for sure.
I only have 2 and I'm done. I have a grandbaby though, we can go into the grandchildren, like that works.
But that's a side note. Yeah, so you were asking what happens if
If
we
they're
don't
more,
put
yeah,
them
if they're
in tummy
always
time.
in the stroller,
Well,
this
guys,
is what happens.
yes.
6 months old, always in the stroller.
So we are very aware that, you know, we all have to work, and it's very hard for parents to be either wearing their child, which we love wearing, baby wearing, we love it, right? But eventually people go back to work and it's hard to do. So babies are in car seats, right? They're in strollers, they're in the bouncy chairs, they're in all these apparatuses, the swings, right? That all they're doing is being in this position.
And we have more and more and more apparatuses nowadays.
And they're super expensive, okay? And
you get tons of them in the baby shower and you're like spread it through the whole family's house.
and of course we're against a lot of
Yeah.
that. I'm sorry.
Yeah.
But yeah, so what happens is the baby is going, if they're in a daycare setting, they're going to be in that, right? Because realistically, or they won't be carried or be placed in tummy time in these type of settings. And then the drive home and this and that. So they're always in that supine position is when we're facing up, right? And so the head is constantly touching a surface, and because they don't have like the strength yet, the neck strength to really control their head, they're always just going to be on that flat surface, and then they'll develop a condition that's called brachiocephaly, which is the flat head, or plagiocephaly, which means like it's shifted and not the head shape is not rounded as it's supposed to be, and so they may require a helmet, okay? And then
what are the
for
future repercussions of having your cranium not in the right shape to take your brain?
Wow. Well, again, our brain isn't housed in our skull, so then the shape is aesthetically
Well,
there's different
aesthetically for
levels,
sure,
right?
but,
There's different levels, and that's a specification where they would go get measured to see like if it's a mild, moderate, or severe case. Of course, in severe cases, there is repercussion with the brain because in kids, the head's supposed to grow, and if it doesn't have room and these bones fuse in the wrong position, it could cause shifting and stuff. So those are things that of course require specialists to really assess that and get helmets for that. But also people don't think about the jaw, like they think about the top of it, they don't think about the jaw part of it, and so it could affect feeding and speech and language and all that. So we would call our speech friends to help us with that part of it, right? But it affects the development overall of our babies and our children. And so the best way to prevent all those troubles is to do a tummy time routine, and really emphasize it. And sometimes I know the study showed excellent progress with what it was 1 to 2 times a week. My home program for my patients are actually every day, every diaper change, right? So those whoever's a parent who knows that the babies do need a lot of diaper changes, and so you change their diaper, and if it's waking hours, of course you're not going to do this in the middle of the night, you want your baby to sleep, but during waking hours, every diaper change, you do your diaper change, and you just put them in that tummy time for a few minutes, right? Like you were saying, if they hold 2 minutes and then they start to fuss, hey, we'll take the 2 minutes, but eventually you want to progress it where by 6 months they're actually playing in that position and they're enjoying that position, and they want to experiment with that position to the point by 8 months and 9 months and 10 months, like they're crawling or what we call creeping, and they're doing all the things because that's going to lead to other things that they need. So again,
the right development, even how well they do in school, right?
Absolutely.
So there's a whole rabbit hole.
Because it helps with reflex integration and all the things, which is a whole other topic we could talk about.
I do want to say we're probably getting ready to wrap up. I do want to ask you guys, or maybe the viewers, if you guys want to share with us, maybe use the comments and share with us your experience. How did you guys do with your kids? Did you see a difference between one child to the other? Have you had an experience where a child who's got a deformed head because of that? Like, interact with us a little bit. Don't forget to subscribe, to share the stuff. Right?
Well, before we wrap up, I also just want to add that again, all of this should be supervised, like Dr. Ruff was saying. So the middle of the night probably wouldn't be good because you're gonna fall asleep.
We're both falling asleep.
So that's where the fear comes in, like we were saying earlier about the SIDS and stuff. But it's easy for sometimes medical professionals to give general advice for safety. But if you really want to get into the ins and outs of building the strength and stuff, then that's why you come see your physical therapy providers, because we can really teach you all the different ways, positions, even just holding a baby, like while you're doing stuff and supporting their head and just doing this. I mean, it's promoting,
because they naturally gonna want to look up. They're naturally gonna be curious about what they're looking at.
So that's where we can come in on the other end of knowing really the safety aspects of that and how to know the baby's strength and what they could do and what they can't do.
So when not sure, definitely visit your licensed provider. We can only give you so much from this type of point of view, but I think that educating moms and caregivers to that, I think it's really important, particularly because I see the difference in the kids out there. And
I want to say that this is not just for the child that maybe was born without a diagnosis or anything. Actually, tummy time is going to be very important for the child with the special needs or the diagnosis. So again, those specifications should be with a provider that could do a specific evaluation for each child's specific needs. If your baby was born typical 40-weeker, normal pregnancy, normal birth, and they weren't in the NICU, and you just get kind of sent home like, here's a baby, good luck.
We'll figure it out. Don't got a menu for you.
You may still not know what to do, but again, your tummy time, you could always seek out, is what we're trying to say.
Yeah.
You could always
With
seek
so
out
much
to get
information on this too, and just look for the credentialed clinicians, people that know what they're talking about, that look at research, what's evidence-based, what's research. Sounds like a bunch of words, but what that means is it's been tried out, it's been debunked, or it's been validated. Anything you see out there that is related to medical science, anything like that, should be somewhat backed up by studies that push to understand really does it work or not. Some people could swear by it and be like, like a case by case type of thing, but that's why we bring those up for you. And there was a little summary here. What is this over here?
Just again,
Make sure that we
so we covered.
What's the takeaway, Doc?
The takeaway is definitely do tummy time. Okay.
And I think we were saying do tummy time as an adult too.
Yeah.
Work your extensors. If you have postural issues, I mean, some people are so into crunches and they forget the other side.
And then they're walking around like they're super tough, but then they turn and they look like a C. Like,
so
bring your
it's
spine
for everyone.
back. Extension is a good thing.
Yeah.
Hyperextension, maybe not as much, but extension, yes, that's a good thing. We need that. That's what we walk around with, and let's get it started early on.
Yep.
As soon as they're out.
Yeah.
So you wanna wrap it up, Doc?
All right, guys. Well, thanks for joining us today. Movement does matter, so let's start with tummy time.
All right.